Hello and welcome to At the Heart of Health with Dr. James Marcum. In today's well-marketed world, it's hard to know who or even what to believe when it comes to health care. In each program, Dr. Marcum, a board-certified behavioral cardiologist, takes a balanced approach using common sense modern medicine and the ultimate source of truth, the Bible, recognizing that at the heart of health is love.
I'm Tim Coaches. We've been getting a lot of questions about cardiovascular disease, and who to better answer these questions than Dr. James Marcum. Jim, welcome to the show.
It's nice to sit on this seat, actually. A lot of people have asked, well, why don't you answer some of these questions occasionally? You know, you get all sorts of guests as far as cardiovascular disease. So it's my pleasure to actually sit in this seat and not that seat and answer all the different questions we've got regarding cardiovascular disease. It's actually a very important topic, and we must answer these questions so people can avoid having heart attacks.
Well, we've got questions that run the gamut. We've got heart attack, medication, diet. All of that has to do with lifestyle. Let's get to our first question. We've got Ken from Indiana. He says, my sister-in-law had a heart attack 2 weeks ago. And he says, I never have seen a doctor and don't know much about this sort of thing. Now, we've got two things here. Number one, we're talking about his sister-in-law, and obviously Ken has never had a heart attack, so we got to look at that. What caused the heart attack, and will I have a heart attack?
Well, this is a very important question to address, Tim, because a lot of people don't realize it. Young and old people have heart attacks. The youngest heart attack I've had was 14 years of age.
Wow.
The oldest one I've had was over 100. Heart attacks are coming in. More and more people are having heart attacks. We're going to talk what heart attack is in a minute. But basically, when we have a heart attack, the heart doesn't get enough blood. When the heart does not get enough blood, bad things can happen. One thing that can happen is it can have a funny rhythm called an arrhythmia. Two of the ones that are deadly is called ventricular tachycardia and ventricular fibrillation. That's why now there's such an emphasis on defibrillators. Early treatment of a heart attack might save a life. Within the first 4 minutes, we can shock the heart back into a normal rhythm. But in a heart attack, the artery's not getting enough blood flow through to the muscle. That can happen from about 4 different mechanisms. One, there could be a small plaque, and all of us can have these cholesterol plaques. The plaque becomes unstable and ruptures. When it becomes unstable, guess what? Clot occurs. No blood flow can pass. The muscle becomes unstable because it's not getting enough oxygen. Boom, a heart attack. Another heart attack can happen as cholesterol gets in the arteries over years and years and clogs it up. In young people, frequently we have heart attacks when the artery spasms. There's no blockages at all. It just spasms down. What are things that can cause that? Well, unfortunately, we see that a lot of people that take drugs like cocaine. Sometimes cigarettes can cause it. And another type of heart attack is where something can float into the artery, a clot from somewhere else. But by far, the most common cause of heart attacks are these small plaques that rupture. So that's what causes a heart attack.
Now, if I may, if I'm not mistaken, Tim Russert had that issue.
Yeah, he had a heart attack, and it caused sudden death because he had one of these dangerous arrhythmias that occur.
Okay, so people are familiar with that. They'll understand it.
Yeah,
it is a very critical thing.
And it's very important for people to know. So when a person's having a symptom of a heart attack, which is pain that doesn't go away, it might be crushing or shortness of breath, I would not wait around. I would not assume that it's indigestion. I would get checked out right away. And when you go to the hospital, if you're finding that you have a heart attack, this is a great place for modern medicine. Now, biblical medicine, or the way the Bible, is great for preventing heart attacks, but when you're actually having one, that's a place for modern medicine. So Ken's question is, he doesn't know what caused the heart attack. Many factors can cause the heart attack, but what I think about is it's just not one thing. Years ago, in the 50s and 60s, they thought about heart attacks as only a male disease, and it mainly came from cigarettes. So for a while, they thought heart attacks were just from cigarettes. Then years went by, and they said, oh, heart attacks are due to cholesterol. But now we're finding out that anything that puts stress on the body can raise the risk of having a heart attack. And there's certain things that put stress more than others. For instance, cigarettes, high up there. Yeah. High blood pressure puts stress. You've heard about diabetes. High cholesterol causes stress. People don't think about it, but genetics, bad genetics, put stress on a system. Not sleeping enough at night, lots of worries, depression, all of these things add up to the stress line. And when the stress line goes up and up and up, what happens to our bodies, we make this substance called adrenaline. Adrenaline puts stress on our bodies. It makes another chemical called cortisol, which could help us store cholesterol in the body. If this happens acutely, stress, it's great. You know, if I scare you or if I'm going to hit you, you're going to run away, right?
I would hope so.
But can you imagine what happens if stress happens day in, day out, month in, month out, year in, year out? This is not the way God made us.
So you're talking about a chemistry change in the body that is not healthy.
It happens chronically, and sooner or later it can lead to a heart attack. So what causes the heart attack? Different stressors. Now, how can Ken lower his risk? And this is probably the most important question we can answer today, because this can literally save lives. Think about it. If cardiovascular disease claims 42% of all deaths in the United States, that's a lot of people. That's more people that will die in wars. That's more people that will die in car accidents. That's more people that will die of infectious disease. This is a big issue. Now, so to lower their risk, we want to lower their stress. We can't do anything about Ken's genetics, but we can make sure his cholesterol's good. We can make sure his blood pressure's good. We can make sure his cholesterol's good. We can help him exercise and sleep better. We can help him remove some of these other stresses, which can gradually increase his risk of having a heart attack. So I want to say to Ken, what causes the heart attack is all these stressors, and how he can lower his chance is making sure his stressors, especially the big three, cigarettes, diabetes, and high blood pressure, are in check.
A lot of people have to examine their life.
And this is such a big, important question, Tim. This could save someone's life today. And you might know someone that might be having these symptoms or having these stressors. You want to warn them. This could be having a heart attack. You know, we want to help this problem be healed.
I agree there. Let's get to another question.
Okay.
Tracy from Washington writes, my 58-year-old husband recently had a heart attack and subsequently a 4-vessel bypass surgery, which is a quad bypass. All right. His doctor put him on a very strict diet. He is considerably overweight. He has become very depressed, although seems to be healing perfectly. Do you have any suggestions for her?
I do, and this is a great question from Tracy. I see it very often, Tim. People, after they have a heart attack or any health problem, depression sets in. Depression is one of our most damaging chemical reactions we have in our body. And if you think, how did God design us? Did he design us to be depressed?
Oh, to be happy.
He designed us to be happy, to have joy. That's a good thing for the chemistry, to have laugh. Also, God designed us to love. And I want us to remember those two, happiness and love, because we're going to be getting back to those. Now, a bypass surgery means that your arteries were so clogged up, the only thing we could do to treat them was to bring blood from one vessel to another, a conduit that brings blood south of the blockage. We didn't take away those blockages. They're still there.
Right.
So you say, well, why do we even do a bypass surgery at all? It helps improve symptoms. And as symptoms improve in certain high-risk anatomy, we can lower risk dramatically by getting people back in an exercise program, getting them doing the things that will lower the risk of heart attack. Unfortunately, the people become depressed. Now, a lot of what we do that stresses our body does come from diet and high cholesterol. And unfortunately, we do have to put people on pretty stringent diets. But I would suggest if you can be on that stringent diet and be happy, great. But if you cannot do that, well, let's see. Let's back up a step. Well, what are some basic principles that we can do to become happy? Well, one of the things we want to do is not eat big at night, because that's when your body stores fat. You've heard of these circadian rhythms.
Right.
God made us to rest at night. We don't rest our digestive system. We store it when we don't rest at night. Another very important principle in this diet program is eat more fresh fruits, vegetables, nuts, and grains. So as we start feeling, and I try not to take anything that makes a person happy away at first. Let's say her husband needs a little bit of candy to make him happy. Well, I would say to them, well, let's not take that away yet, you know, unless he wants to feel good. But let's try to minimize that. Maybe eat a little bit at the end of a large, you know, after he's eating the good things.
Just a small portion of it.
Make it for pleasure and not for nutrition. And also give him as much love and support as you can. and also try to make happiness the center of your cornerstone. Now, some people, after they've been on the heart-lung machine, have bad chemistry. And some people we do have to put on a short-term antidepressant if their chemistry doesn't improve after bypass surgery. But those people are far in minority. So those things might help her. You know, let him have the food he likes in the right amounts. Give him lots of love. Try to add some more happiness in his life and see if that might help.
And be positive.
Yes, be very positive about all these things that we're doing.
Well, that's good. Important. We do have a lot more questions here. We're going to be talking about Benjamin from Mississippi. Now, he wrote in and said, I had a heart attack a month ago. They put a drug-eluting stent in my artery. Why do I have to take medication, Plavix? And we're going to have to get to that question, answer that question, after we get back from the break. But explain to me real quick, if you can, a couple seconds, Plavix.
Well, Plavix is a medicine that helps prevent blood from clotting. After the stents happen, we have a stainless steel in the artery. And we'll get back to that after the break, and we can go more into in greater detail.
Yeah, because a lot of people get stents.
That's exactly correct.
So we'll cover that. When we get back, we're going to continue this discussion on cardiovascular disease, Plavix, aspirin, and stents. We'll be right back.